Hello, everyone. Thank you so much for being here. Let's give ourselves a big round of applause. This is a packed room. I'm happy to see it. One big housekeeping rule before we get started. Because it is a packed house, please don't put your bags in the seat next to you. Try to make as much room as possible. Really appreciate you all being here. It's going to be an awesome afternoon. My name is Dani Nierenberg, and I want to welcome everyone who is joining us in person and online for our summit focused on advancing food as medicine in support of the White House strategy on hunger, nutrition, and health. Again, I'm Dani. I'm here with my co-founder, Bernie Pollock, who's here in the front row. Food Tank, for those of you who don't know, is a research and advocacy organization devoted to highlighting how food and agriculture can be the solution to some of our most pressing environmental and social challenges. We hope to inspire, motivate, and activate positive transformation in how we produce and consume food. I'm really thrilled to be back at the Friedman School. This is a little bit emotional for me because it's like coming home. I'm a graduate of the Friedman School. And I was really able to learn from the best minds on food and agriculture and nutrition. I had amazing professors and internships that helped me become the person I always wanted to be. I am so grateful to the Tufts community. People like, former professors like Molly Anderson, Kathleen Merrigan, Willie Lockritz, and of course, Dr. Mazafarian and Dr. Economos. I really consider them all mentors and family, or at least part of the Tufts Mafia. So thank you all. For this summit, I want to especially thank Julia Sharib, again, both Drs. Mazafarian and Economos, and Emily Callahan for hosting us and being incredible collaborators. Today's programming would not be possible without all of them. I also want to give a huge thanks to the White House Office of Public Engagement, including Catherine Oakar, Kellyanne Blazek, and Will McEntee. Talk about people who become like family. They've been amazing co-conspirators on today's event. And I really want to acknowledge their leadership and really tireless work to ensure that the Biden-Harris administration continues to focus on bolstering food security and improving eaters' health and well-being. Last September, the White House Conference on Hunger, Nutrition, and Health was truly, truly historic. But as we know, that event was only the beginning of the work that needed to be done. In the months that have followed, the administration has been working strategically and again tirelessly to implement the national strategy to end hunger, reduce diet-related diseases, and increase physical activity among all Americans. For the White House to shine a spotlight on issues many of us in this room have been working on for decades means more to me personally than I can properly articulate. It makes me proud to be an American, which is not something I could always say. Throughout the years, I've spent a lot of time protesting particular administrations who will remain nameless. But now we have this administration that works across aisles and cares about our food and agriculture systems and the ways that they contribute to good health and livelihoods. So today, we are all here together in support of these efforts and to identify new opportunities to advance the integration of nutrition and health and to improve food and nutrition security, issues that represent 2 of the 5 pillars outlined in the White House National Strategy. We'll be documenting what happens here today, including the panels that you'll see on stage and in your breakout sessions. That means that the role each of you play today is absolutely critical. No one can sit this one out. We will begin in just a moment, but a few words about the afternoon. Today's event would not have been possible without the generous support of Stop and Shop, and I want to give a big thanks to Stephen Jennings from Ahold Delhaize USA. I hope those of you who have been here for a few minutes have had a chance to enjoy the delicious lunch spread provided by Farmer's Fridge, who, since their business started, have supported Food Tank. And I want to thank also Traditional Medicinals for supporting today's summit. Again, without all of them, we wouldn't be here today. This afternoon, you're going to hear from more than 40 speakers who represent the public and private sectors, as well as the nonprofit and philanthropic communities. We have chefs, professors, doctors, business leaders, public health advocates, scientists, elected officials, and researchers, along with some of the leading food and agriculture journalists in the Boston area. I promise you that today we will end on time no matter what. The conversations will be very dynamic and fast-paced. I have to ask, if I cut a panel short, no matter how interesting or engaging it is, that you forgive me. There will be time for networking during the reception, which I hope you all stay at. Please feel free to leave the room for snacks or beverages or for bio breaks or for fresh air. We want you to be as comfortable as possible. And please, again, make sure you stick around for the reception where you'll have a chance to speak with your fellow attendees and the panelists. And everything you see today will be available on Food Tank's YouTube channel. Before I introduce our next speaker, I want to ask that you share your favorite moments, or maybe your least favorite moments, from today's conversation using the hashtag FoodTank across all social media platforms. We will do our best to reshare your posts and respond to your comments throughout the day. And now let me welcome someone I have admired for a very long time. She has devoted her life and career to the issues that we'll be talking about today and has set an example of what both an academic and an advocate can look like. Dr. Christina Economos, the newly named dean for the Friedman School at Tufts University, it is my sincere honor to welcome her to the stage.
Thank you. Welcome, everyone. On behalf of the Friedman School of Nutrition, Science, and Policy, I'm so glad to see a full room here today. And let me just pause and say, you are exactly where you're supposed to be. This is a group of enthusiastic and dedicated people who are thirsty for more. They want to really understand the issue, and I also know want to leave today and have an impact. So I'm so glad that you are all here today to join us. The second thing I want to say is the Friedman School is a place that's very welcoming, and we are so glad that you chose to spend the afternoon with us today, and we hope that you'll come back. We hold a lot of different events and conversations, and it's a place that we feel is really important, that everyone feels they have a space and a part of the conversation, and we want you to feel like this is your home. So as Danny said, she feels like she's coming home. For some of you, I hope you feel like you walked into our home for the first time, that you'll come back and join us in the future. So we're so delighted to be hosting today, and particularly as Danny Nierenberg, as you already heard, co-founder and president of Food Tank, along with Bernie, her co-founder. She's an alumna of the Friedman School, and we couldn't be more proud to have her running this organization and joining us today. And I'm also proud to say I'm an alumna of the Friedman School, so we are taking over today. But one thing we do here at the Friedman School is put people out into the world to make a difference. And so you're seeing examples today throughout the course of the day of people who are doing that. So for those of you who are not familiar with the Friedman School, we're the only standalone School of Nutrition, Science, and Policy. We're 40 years young, and we have a powerful and needed impact on nutrition and health worldwide. We conduct research from cell to society, we train future leaders, and I think most important to many of us, we reach deep into communities and co-create innovative and equitable food and nutrition solutions across the globe. So you all know that unhealthy food is now the leading cause of poor health in the United States and worldwide, causing enormous burdens to malnutrition, obesity, and other preventable diseases. But we also care a lot about what our society is facing in terms of stark racial, ethnic, and socioeconomic disparities with respect to access to high-quality food. And inequities across the food system is an area that we dedicate a lot of our research to at the Friedman School, and you'll hear more about that today. So the 2022 White House Conference on Hunger, Nutrition, and Health was an incredibly important milestone in the field of nutrition, and convenings like these are what's keeping the momentum going and the hope alive as we all strive to implement the Biden-Harris administration's national strategy on hunger, nutrition, and health. So I just want to take a moment to acknowledge my colleague, Dariush Mozaffarian, and his leadership in this space. And I want to thank him for all that he's done and all that he will do to advance policy across the U.S. Thank you, Dari. And I just want to close by saying today's event and the conversations and the engagement that will occur in this room and with all of you online and after we all leave is exactly what we're proud to support at the Friedman School and take part in. So thank you for being here today. Enjoy the event, and I look forward to talking with many of you.
Thank you so much, Dr. Economos. It's such a pleasure to see you and to have you here. And congratulations to you, too. Bernard, could you come help me? Thanks. Oh, I got it. Okay. Sorry. I'm a little broken right now. So you'll get a chance to hear from Dr. Economos later in the program, and you won't want to miss it, so please stay here. It is now my pleasure to welcome to the stage Kat Oakar, the Special Assistant to the President for Community Public Health and Disparities in the White House. She and I will have a really fun fireside chat about the Biden-Harris administration's national strategy on hunger, nutrition, and health. She's one of my very favorite people, and I'm so glad I've had this chance to work with her. So please welcome Kat to the stage. So, Kat, thanks so much for being here.
Thank you so much for having me. Oh, I feel like Britney Spears with this.
I know, right?
Yes.
Until it falls off.
Until it falls off. That doesn't happen to Britney.
So I get to interrogate you.
Great.
And I'm really excited about it. So I do want to start by talking about the national strategy and why was it so important for this strategy to, and the conference to happen last fall? Why was that such a pivotal time?
So many reasons. First of all, hi everyone. It's so good to be here. Hi to those of you online as well. And thank you so much, Danny, and to you and your team. I mean, for folks in this room, they are masterful. It is just incredible. Your team is incredible, and huge thanks to the Food Tank team and Tufts for having us all here today. And as the dean mentioned, keeping the momentum going, which is so huge. So the reason we had the conference was several reasons. One, the last conference was 50 years ago, and at the time, we were facing vastly significant rates of hunger. And from that conference, so much came out of it. Things like SNAP and WIC and school meals, improvements to those programs as well. And so 50 years later, we're still dealing with hunger. But now we have this whole other set of issues in terms of chronic disease, in terms of diet-related disease. And so the president was very much focused on, look, we need to end hunger, but we also need to really reduce diet-related disease, because as intersectional as these issues are, they are taking such a burden on this country, such a toll on this country, and that's unacceptable. I mean, the fact that we're looking at rates of 1 in 10 households that are food insecure, 2/3 of American adults that are overweight or obese, 1 in 3 children that are overweight and or obese, diabetes numbers ticking up, hypertension numbers ticking up. And so there are significant issues here that I think are not only leading to poor health outcomes, but also decreasing workforce productivity, having an impact on how much money we spend on healthcare every year, and that affects us all, as well as things like military readiness. And so really the issues were so apparent and the numbers were so sobering, but also the opportunity was so great. I think we very much saw that if we have this conference, the energy and the momentum that can come from it is unparalleled. And we're really at a truly exciting time. Hard to believe we're more than 6 months after the conference, but really I think we're at such an important moment to continue to make change and make progress from that strategy and that conference.
Absolutely, and the issues that you outlined, the problems that you outlined are truly unacceptable. But as you also said, the opportunities are so great, and that's part of the reason we're here today, to continue those opportunities, to find those unusual collaborations that will really make things happen. For me personally, I would love to hear a little bit more about how the 5 pillars were sort of constructed. I feel like there were like, late nights, probably eating not so healthy food
Yeah.
to come up with these
Yes.
pillars.
Yeah, so I think it was a lot of late nights and early mornings. But I will say, and I think so many of you submitted comments, and we read literally every single one of them. And so much of the feedback that we got from external stakeholders, like all of those in this room, virtually, really fed into kind of how we built those out. I think we knew what the issues were, but thinking about everything from food access, food affordability, local food procurement, all the way to why does research play a role, all came through in the comments that we got and the listening sessions that we did, and the conversations that we had with people with lived experience, and thinking about what people who deal with hunger day in and day out, or people who deal with diet-related disease have to face. And so that's really kind of how we thought about building the pillars, was, a lot of the feedback that came in, what the evidence shows certainly, and kind of what those with lived experience were telling us were some of the barriers to leading a healthier life.
And it was really great that those folks with lived experience were part of the conference, that they were able to engage directly with the White House and with all of us. That's really extraordinary.
Well, I think it's essential, and I think it can be so easy to get lost in the work that we do day in and day out, because nobody has enough time in the day, nobody has enough hours or computers to do enough of the work, but we're doing this to help people. And if we're not grounding ourselves in what is actually happening in people's lives, then we're not doing as well as we could be. And so that was really fundamental to us to do, and to really highlight that perspective at the conference, but also inform our strategy as well.
Absolutely. Thank you for that. I'm interested in hearing from you what progress you've made over these last 6 months.
Yeah, so much. And so, we've done a number of things. I mean, the fact that we got summer EBT to be a permanent program is huge. And we don't talk about it enough, and I think it is a huge focus. But we're also saying, I know we're talking so much about food as medicine today. We've approved a number of demonstrations from Massachusetts to Oregon to Arizona to Arkansas, and Medicaid, that are testing some of these strategies to improve nutrition security, to improve nutrition counseling in our Medicaid population. Because we know, as Dean Economou said, as you said, Danny, disparities persist year after year, and not only in Medicaid populations and communities of color, in our veterans populations, in the military population, and rural populations. And so we're very much trying to be very deliberate about having this be, as we continue to say, whole of government. And so what we mean by that, in addition to summer EBT, in addition to some of the CMS waivers, we're thinking about this across 20 federal agencies. Some people don't even realize that there are 20 federal agencies, but there are. And so, thinking about HHS, thinking about USDA, but, our Veterans Affairs, the Department of VA, just launched a produce prescription program in partnership with Rockefeller. So they're doing a pilot in Houston and Salt Lake City. The Indian Health Service is also doing a produce prescription program. The Department of Defense and VA have committed to screening everybody that comes through the doors for food insecurity. And so if you think about the potential here, the vision of, if everybody that comes through the healthcare system is screened for food insecurity, if every provider is armed with the tools to screen and refer, if there are enough dietitians in the world to be able to offer those services, the opportunities are endless, and the need is tremendous. And so that's just kind of a little bit of a taste of what we've done. But I'll also say, this past March, we launched what we are calling the White House Challenge to End Hunger and Build Healthy Communities. And this is really our attempt to galvanize the second tranche of commitments, because around the conference, we galvanized $8 billion worth, which is incredible. It's a lot, but it's not enough. If we're actually going to end hunger, if we're actually going to reduce diet-related disease, we need way more. And that is where you all come in. And it doesn't matter if you're a small business, small restaurant, or a major corporation. As you mentioned, everybody has a role to play. And so would really encourage you all to think about what that could look like. We're really excited to encourage all of you to think about making a commitment. We're hoping to have an event in September, October to highlight what those commitments are and really tout the incredible work that is happening and will still happen and want to work with you. And so if you're interested, I would encourage you to go to whitehouse.gov/hungerhealthconference, submit an interest form, and let's have a conversation. We are on every single call with our partner, the CDC Foundation, and would love to talk more about what more we can do, because as I mentioned, the potential is so huge, and it's such an exciting time.
It's such an exciting time, and I have to commend Kat and all of her colleagues again. They will be on every call. They will work tirelessly. She's not just making this up. I know from experience, so please reach out to her. I'm wondering, Kat, what are you looking forward to most from what we'll hear today?
Well, it's so amazing to see such excitement in the room and like interest in food as medicine. As like a public health nerd, this is like heaven to me. But I think what I'm most excited about seeing and hearing about is the potential, is what everyone from a medical school or a public health school or a dental school to a city to a major corporation like Stop and Shop and Google, who I know are here, can bring and are already doing, but are thinking about kind of what that 2.0 looks like. Because as I mentioned, we have to make this a whole of society approach. And I really think that, and hopefully what comes through today is that we're building a movement. The time is now. I think finally, for those in this room, we're almost like an echo chamber. We get it, but I feel like it's finally coming across beyond just this room, into the healthcare system, into communities, into states and governments who recognize why food as medicine can transform lives. And so I think that's what I'm most excited about hearing is the potential and the opportunity and the excitement.
Me too, and we really are building a movement that will spread far beyond Tufts and far beyond the White House. So thank you again, Kat. What a pleasure to work with you.
It's so amazing to work with you. Just so excited to be here and excited for the day. And if I can do anything to help any of you virtually as well, please reach out to us. We are, as Danny said, at the ready on email 24/7 a day.
Kat will be here all day.
Yes, I will be here all day. So look forward to chatting and meeting many of you.
Please give her a round of applause, everyone. Thank you, Kat.
Yeah, go.